The state legislature recently passed a bill that provides new controls for the cost of prescription drugs reimbursed by Medicaid. The bill was passed with agreement from consumer advocates and the biotech industry. Meanwhile, advocates at Healthcare for All are backing up the call for broader reform with a statewide public opinion survey. To tell us about the results is the group's co-director of policy and government relations, Alex Scheff. Thank you very much for being with us, Alex.
Absolutely. Happy to be here.
First of all, talk about what's been happening to the cost of prescription drugs here.
Absolutely. So we'll start with Mass Health, since that was where the action was recently taken. We knew that the cost of prescription drugs for the Mass Health program, that's our Medicaid program, more than or nearly doubled over the last 5 years, from 1.1 billion to 1.9. So it was a major cost driver for them.
Now, is that cost increase, is that mainly because there's so many new wonderful drugs coming out and we really need them badly, or could there be other reasons?
Well, there's a couple of different kinds of problems here. One of them is new drugs that come out where you have these really big prices. Now, some of those drugs, the value of the drug really aligns with the price. So you could have a drug that cures childhood leukemia. It's going to cost a lot, but it makes sense because the values align with it. What's concerning are when you have drugs where you had an existing patent, they tweak that patent, the drug manufacturer, and then sort of release it, but they increase the price, rapidly, and you get a really big price that isn't aligned with the new value of that drug. At the same time, there are some maybe not as expensive drugs, things like insulin or EpiPen, but you've seen these rapid price increases for folks. And in those cases, we also think you need to do something, and our legislation addresses those.
Well, you've made me curious again here. Why is insulin suddenly so much more expensive? I mean, this has been around for ages, hasn't it?
Sure. I'm not sure that I can give you an exact answer. I think we don't think that these price increases are necessarily warranted, or that innovations in how the drug is dispensed warrant those kind of price increases. But we know that this is a drug that is life-saving for people. Folks who are diabetic need it like they need water, and so it's really not reasonable to have it be $800 a month for someone. And we heard some stories, actually. We had an event earlier today with consumers. One of them had talked about how insulin for them costs $800 a month, and that's just not feasible for a lot of folks.
I'm sure many consumers are unhappy with what's happening with the prices, but what else did you find in the survey?
Yeah, absolutely. Let's turn to the survey. So just to go back to this, so we were really pleased to see the compromise language that came out in the Mass Health budget. We think it was a major step forward to rein in prescription drug costs in the Mass Health program. But we know that 3 out of 5 residents in Massachusetts get their health insurance through private insurance. It's employer-based coverage, insurance that they buy through the connector or on their own through an insurance company. And that's according to the Center for Health Information and Analysis. We know that we need to do something for the cost there. I think the big finding in the poll, where voters stand on this, is that nearly 9 in 10, 88%, support legislation that's before the legislature right now. And that legislation would do 2 things. It would have both some transparency, get inside the black box of prescription drug pricing, which we just don't understand very well, and understand it a little more. But then it also would have some accountability by setting an upper payment limit on what the highest cost drugs, what could be paid for those very highest cost drugs.
This has been the news, and we're talking with Alex Scheff from Healthcare for All. I'll start with transparency. Mm-hmm. It sounds wonderful, but in practice, is it really that easy? I mean, this could get pretty complicated.
Sure, it is complicated. Fortunately, we have some great structures in the state, the Health Policy Commission, for example, that can help disentangle this, kind of get under the hood of these prices and understand it. But one thing in the poll that really jumped out was that voters they think transparency isn't enough. They want some accountability. They want something that's really going to bring down costs. So specifically, we polled and they found that 82% of voters wanted a bill that includes both the transparency and accountability through an upper payment limit for these highest cost drugs, compared to just 12% that wanted just transparency in the legislation.
Of course, what you're really getting at here, too, is the leverage for either the consumers or the state to bring down costs. With this new language in the budget legislation, does the state really have that much more? I mean, it seems like there's no compulsory negotiation going on here. So, I mean, how are you going to make these companies come around?
Sure. So the state is able to do something like set payment limits. That's sort of how we settled on this measure of an upper payment limit. We did a lot of research over a number of months to think about what kind of levers the state has to address rising prescription drug costs. You know, folks know the federal government doesn't seem to be moving particularly quickly on this, and they're looking to states to address the problem. So we do think that we can set these upper payment limits. We've gotten some good legal analysis to help us make sure that that's the case, and we feel confident.
In practice, I imagine a lot of people see a physician, and the physician writes a prescription, and people, you know, I've certainly done it often enough myself. I just do whatever's on the paper, and I pay whatever they charge me.
Sure.
But is there anything else that consumers can do to look for a bargain or something? Yeah.
Sure. So looking for a bargain is hard. One of the components in the legislation that also polled quite well is a requirement that pharmacists disclose to the patient when it can be less expensive to pay a cash price for a drug as opposed to using their insurance coverage. So we would require pharmacists to disclose that to the patient, which is a good way for folks to be able to understand that.
One of the things I'm wondering about, whether it's in your survey or just anecdotally, is there anything you know about people who deny themselves drugs simply because it's just too expensive for them?
We do, and one of the findings from this poll was how personal this issue is for people. 36%, over a third, had said that they had not used a prescription drug as prescribed due to cost issues. So that included 23% who had skipped doses or cut pills in half. And others who hadn't filled a prescription, about 22% who hadn't filled a prescription because they couldn't afford it. So we heard pretty clearly that this is an issue that is really comes home for people, and everybody has that experience.
And of course, you've got more of this on your website there.
We do. So if folks are interested in this, HICFA-MA. .org is where they can go. We're really looking to hear from folks who've had experiences, and of course, if they feel strongly about it, they can always reach out to their legislators and let them know it's an issue they care about. I should also mention, you know, while this is an issue that cuts across really all demographics, there were some folks who had the most experiences with not being able to afford prescription drugs. So Latinx individuals, for example, 52%, over half, had an issue affording their medication. It also disproportionately impacted women and young folks, 18 to 29, as well as those with lower incomes. So.
Very interesting. Thank you very much for being with us.
Absolutely. Thank you for having me.
Scheff from Healthcare for All. Still to come, we'll talk with a new leader advocating for Latinos in education.